And again, axillary vein will be turning into subclavian vein once it passes the clavicle bone itself. As you recall, veins will be bringing blood back to the heart. So all those veins we learned in Unit 2 are traveling up the arm as they're bringing blood from the arm itself back to the heart. Subclavian vein here is going to meet up with internal jugular vein, and we'll see a little bit better picture here in just a moment of where internal jugular vein is actually coming from. But it's draining the internal structures of the skull and the brain itself, and it's going to be dropping right down here, and it's actually going to travel deep or underneath the sternocleidomastoid muscle, and then it's going to meet up with subclavian, and they're going to form the brachycephalic vein of either side. Each brachycephalic vein here comes together, so left and right, and they form a V-shaped structure. Now, this is a really useful landmark to use to your advantage. This V shape right here is real easy to find on models or pictures or cadavers, and it's going to be forming the superior vena cava right here. And the superior vena cava just going to drop blood off into the right atrium of the heart. There are a couple of branches we need to talk about of brachycephalic vein. The first one being the internal thoracic vein. Now, these are pretty small little veins, and what they're going to be doing is they're draining the anterior thoracic wall. So on the cadaver, we create a chest plate that can be removed so we can see inside the thoracic cavity. And sometimes these internal thoracic veins are going to be found on that chest plate, and they run just on the outsides of the sternum itself. And other times, they have been removed from the chest plate, and they're just going to be kind of dangling off the brachycephalic veins. We also have inferior thyroid veins, and these are going to be the most medial branches of brachycephalic vein, and all they're doing is just draining the bottoms of the thyroid gland itself. We also have superior intercostal veins that are just going to be draining the spaces between the ribs, and more specifically, the first 2 or 3 intercostal spaces on each side. Left superior intercostal vein is actually going to drop its blood off into the back of the left brachycephalic vein, whereas the right side is different, where the right superior intercostal vein is actually going to dump its blood off into the azygous vein, which is a vein we'll talk about a little bit later. Now here's our thyroid gland again, and there are the veins draining the bottoms of it, and those are those inferior thyroid veins. You can see how they drop their blood off into brachycephalic vein of either side. Now here's a better look at that internal jugular vein. So we can see it coming from inside the skull here, coming all the way down deep to sternocleidomastoid, and then it's going to meet up with the subclavian vein, forming the brachycephalic vein on either side. Now in this picture, we can see the intercostal veins here. So there is the left superior intercostal vein. We can see them actually draining those spaces between the ribs. And again, the left side will drop off into the back of the left brachycephalic vein here, whereas the right superior intercostal vein will be draining into the azygous vein, which we see happening right there. We can also see the internal thoracic veins as they come out and run right next to the sternum here. Let's just highlight those for just a moment here. There we go. And so I'm just going to highlight one side here, and you can see how they run just on the outside of the sternum itself. Those are the internal thoracic veins.